बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलामुअलैकुम। डॉक्टर मोहम्मद शाहिद के यूट्यूब चैनल पर खुशामदीद। सन 2000 में मैंने इमरजेंसी मेडिसिन रेजिडेंट के तौर पर आगा खान यूनिवर्सिटी हॉस्पिटल ज्वाइन किया था और मैं पाकिस्तान का पहला रेजिडेंट था जिसने ये ट्रेनिंग की थी 2004 में। लेकिन क्या पता था कि आज 22 साल के बाद मैं ख़ुद जो है वो FCPS इमरजेंसी मेडिसिन के फ़ेलोशिप के प्रोग्राम के बारे में बात करूँगा। आज हम बात करते हैं इमरजेंसी मेडिसिन की कि पाकिस्तान में इसका क्या स्कोप है, गल्फ़ कंट्रीज़ में इसका क्या स्कोप है, इसकी ट्रेनिंग किस तरह की जा सकती है और पाकिस्तान में ट्रेनिंग FCPS किस तरह कौन सी रोटेशंस हो सकती हैं, ये सारी बात करेंगे हम। और डेवलपमेंट ऑफ इमरजेंसी मेडिसिन इन पाकिस्तान पे मैं एक अलग वीडियो शूट करूँगा। आज हमारी मेहमान शख्सियत हैं डॉक्टर नज़ीर नजीब कपाडिया। आपने MBBS ज़ियाउद्दीन मेडिकल यूनिवर्सिटी से किया, उसके बाद पार्ट 1 किया। पार्ट 1 करने के बाद 5 साल की ट्रेनिंग इमरजेंसी मेडिसिन में की, FCPS इमरजेंसी मेडिसिन में किया और आजकल कुवैत में सीनियर रजिस्ट्रार के तौर पर काम कर रहे हैं। डॉक्टर नज़ीर से जब मेरी बात हुई कि इमरजेंसी मेडिसिन के बारे में आपने बात करनी है तो नज़ीर ने मुझे बताया कि मैं आजकल शिफ्ट जॉब्स कर रहा हूँ क्योंकि उनके इमरजेंसी मेडिसिन में क्लिनिकल शिफ्ट्स होती हैं। तो मैंने कहा जब भी आपको टाइम मिले आपने हमारे स्टूडेंट्स को ज़रूर बताना है, हमारे जूनियर्स को, कि इमरजेंसी मेडिसिन का पाकिस्तान में क्या स्कोप है, अब्रॉड क्या स्कोप है और इसमें रोटेशंस कैसे की जा सकती हैं।
अस्सलाम वालेकुम, मेरा नाम डॉक्टर नज़ीर है और मैं FCPS इमरजेंसी मेडिसिन हूँ। आई वुड फर्स्ट लाइक टू थैंक डॉक्टर मोहम्मद शाहिद फॉर इनवाइटिंग मी ऑन हिज चैनल एंड टुडे वी विल टॉकिंग अबाउट FCPS इमरजेंसी मेडिसिन। सो आई वुड लाइक टू डिवाइड माई टॉक into 3 sections. First of all, we will discuss regarding the scope of emergency medicine. Then the whole program of the CPSP, which would include the training and all the exam pattern and all. And finally, we would discuss regarding the opportunities we have and the way forward. So I ended up accidentally into the emergency department basically after getting through my MBBS in 2011 and from the Ziauddin Medical University, and then getting through my house job in 2012, and after failing the first attempt of FCPS part 1, I ended up as a medical officer in the Department of Emergency Medicine at the Aga Khan University Hospital. So at that time, emergency was a relatively new field, and it is a relatively new field now as well. As if we would discuss with the layman, they would say कि आपकी डॉक्टर साहब की स्पेशलाइजेशन किस सब्जेक्ट में है, क्या किडनी में है, क्या हार्ट में है, क्या लंग्स में है. सो आई वुड से दैट आई एम इमरजेंसी फिजिशियन. So it's a relatively new concept for the people now, and at that time when I started my training there, it was a relatively new specialty for the doctors as well. So when I started working as a medical officer in the Department of Emergency Medicine, I liked the adrenaline rush, I liked the golden hour treatment. So I decided that I will do my specialization in the emergency medicine. So luckily in Aga Khan I was, and it is the pioneer of the training for emergency medicine. At that time the CPSP program was just started, and it is a relatively new program. As I already said, the first batch qualified in 2016 and I qualified in 2020. So the field is new, but it is challenging as well as has a great scope both in Pakistan and in abroad as well. So I would suggest that if you are interested in the golden hour treatment, and if you want to deal a variety of patients, and if you are not worried about the shiftings and the dynamics of emergency, the field emergency is for you, for emergency for doing all the interventions like CVP line, intubations and all. So this was a brief introduction regarding the scope. I would just go through the program now. Regarding the FCPS part 1, FCPS Part 1 we can give in 3 subjects. All 3 are acceptable. We can give either in medicine, we can give either in surgery, or we can give either in anesthesia. So after multiple failed attempts, I was able to clear the FCPS Part 1 in anesthesia. So after you have cleared FCPS Part 1, then you have to choose an institution which would be CPSP recognized. So problem with the new field is that not many institutions would offer you training in the emergency medicine. The 2 pioneers initially were the AKUH in Pakistan, Karachi, and second was Shifa International. But now as the field is progressing, so we are having more institutions. So we are having Indus in Karachi, also JPMC is offering emergency medicine program, also WAHA is also one of the institution which is offering programs, and there will be many in future. So you just have to select the institution in which you will be trained. And yes, AKU is one of the best institutions to get your training through, because it is JCI accredited and it would teach you how to manage patients as per the protocols and as per the guidelines. So yes, after the FCPS Part 1, the regular program would start, in which a resident, like in other specialties, are required to do certain workshops. They have the deadline of getting through their synopsis in the first 6 to 8 months, and if their synopsis is not completed, they would not be eligible for the IMM exam. Regarding the rotations now, before the IMM, you have 18 months of rotation plus 6 months of emergency medicine. So we have 6 months of emergency medicine in the first 24 months, that is 2 years. And then the 18 months are in subspecialties like pediatric emergency medicine 3 months, intensive care 3 months, medicine, internal medicine 3 months, general surgery 3 months, orthopedics 3 months, anesthesiology 3 months. So all this would comprise of 18 months of rotations, and it is required for you to complete those 18 months along with the synopsis, along with the workshop, in order to appear in the IMM exam. The IMM exam would comprise of the 2 sections. One is the written and the other one is the OSCE. The written initially in our time was one paper was best choice questions, BCQs, and the other was SAQs, the short answer questions. But now the CPSP has changed its paper pattern, and for most of these specialties, subspecialties, it is BCQ based pattern. So after you have done with your IMM, you would go through the post IMM part, and this would comprise of 1/3 of the rotation to be done in PEDS. And yes, I forgot to mention that the total program is 5 years. Yes, the total program is 5 years, because when you go through the international programs, they won't be covering the pediatric emergency part. But in Pakistan, the program is formulated in such a way that the pediatric emergency is also included. So in the exams, 30% would be pediatrics and 70% would be adult. This is roughly, but we would cover the pediatric as well. So after the post IMM, you will be required either to submit your dissertation, or either you would be publishing papers, whatever pathway you choose. And then you would appear in the FCPS Part 2 exam. The FCPS Part 2 exam is same. One is theory and the other is OSCE with short case and long case. In my time, till 2020 and 2021, it was one paper was BCQ and the other paper was SAQs, but now both has been converted to the BCQ pattern. This is the general formulation of programs which is done by the CPSP in order to generalize all the programs in order to evaluate the residents in a single manner. So yes, during the training, you would be doing lots of procedures, for example, laceration repairs and chest tube insertion, intubation. So as I told that it is an evolving field. Initially, when we came in, we called anesthesia. for intubation. But now emergency physicians are such trained physicians that they would do intubation on their own. So it's an evolving field with lots of scope and lots of procedures. Further on, I would move on to the fellowship programs, which is not CPSP recognized at this point in time, but you can always go to a CPSP accredited program, which a CPSP scholarship program towards the UK or the Ireland to get your post-fellowship. And post-fellowship is offered in pediatric emergency medicine, in the use of ultrasound in emergency, and it is also given in the intensive care as well. Lastly, I would like to talk about some of the other programs which are being offered at different institutions. There is one program named as MD. So it comprises of 4 years of training. Ziauddin University and multiple other universities are offering it. And those programs are also more or less the same, but they are not CPSP recognized, and the end degree is not FCPS, it is MD. Further on, the scope abroad in UAE and in the Middle East, it is good for Pakistani physicians. The crux of the training in Pakistan is that we are seeing more critical patients. We are seeing more emergencies, which help us in our training in order to groom forward in our future. So people would like Pakistani physicians or physicians from the South Asia to come in the emergency because they are dealing with such patients, a variety of patients with increase in number of patients, with also the increasing criticality of the patients as well. So that's all from my side. I would like to appreciate and thank Dr. Muhammad Shahid once again. He's doing a tremendous job in order to educate the young generation, and this was the gap missing at our time, that we were not guided properly regarding any fields. I would drop my email address with Dr. Muhammad Shahid, and if you would like to ask anything regarding any of the issue, you can always approach me on my email address. थैंक यू सो मच. अस्सलाम वालेकुम.
आपने डॉक्टर नज़ीर से तफसील से सुना कि पाकिस्तान में क्या स्कोप है इमरजेंसी मेडिसिन का, इसकी ट्रेनिंग किस तरह की जा सकती है, और सब स्पेशलिटीज़, फ्यूचर फेलोशिप्स आफ्टर डूइंग FCPS ऑफ इमरजेंसी मेडिसिन कौन कौन सी हैं और किस तरह अब्रॉड की जा सकती हैं. अगर आपने मेरा YouTube चैनल अभी तक सब्सक्राइब नहीं किया तो सब्सक्राइब करें ताकि नई वीडियोस आप तक पहुंच सकें. हम नई स्पेशलिटीज़ के साथ फिर हाज़िर होंगे. तब तक के लिए अल्लाह हाफ़िज़.